Hey, welcome to Medicare 101. This is our series where we're walking through how Medicare really works. We're trying to do this in a very simple way so that you, if you're just now coming on to Medicare, or your loved one, if you're helping somebody out, can really understand all about Medicare. We want you to be able to understand what Medicare is, what it's not, what it really covers, and what the costs are with it, so that you can avoid some of the pitfalls and some of the penalties that can actually come along with Medicare. Today is part two, and we're looking at Medicare Part A. Original Medicare has two parts, A and B, and we're looking at the first of those, and we'll cover Part B in another episode, so stay tuned for that. Hey, my name is Randy Bond. My wife Sandy and I are independent Medicare brokers. We're not affiliated with Medicare or the government, but we help people as they're coming into Medicare and as they're on Medicare find the right fit for their situation. As independents, we don't work for any insurance company. We work with you to find the right fit for your situation. And we understand that not everything is a one size fits all, and we look to find out what is right for you. So let's just jump right in. This is all educational today. And anytime you're working with us, it's all about education. We want you to know what your options really are, how Medicare works, and how to protect yourself, because we understand that in the senior years, your health and your finances are two of your biggest concerns, and we want you to have a happy, healthy senior years when you're on Medicare. So let's talk again about original Medicare. Now, original Medicare is as it was designed way back in 1965, and is still around today. And when you're aging into Medicare or coming on to Medicare under age 65, this is what you're going to have. Even if you have something else, this is going to kind of be running in the background. And those two parts are Part A, which covers your inpatient medical care. So if you can kind of think of just inpatient and outpatient, then Part A is going to cover the inpatient. Part B is going to cover the outpatient. And these have different cost share involved in there. And this is kind of why it's important to know the distinctions in the two. So let's talk a little bit more about Part A and what it covers. So again, it's going to be your inpatient kind of treatment. So this would be your hospital stay. So if you're admitted into the hospital, you're having surgery, or you've had a major event where you're getting care for that, and they've actually admitted you to the hospital, this would fall under Part A and the Part A cost share. Now, you may go to the hospital and they put a little wristband on you, but you're only in and out for day surgery, or they're keeping you under observation care. Those are technically outpatient services, and that would be covered under Part B. So with this, just keep in mind, this is about being actually admitted as an inpatient. It's an important distinction because that's going to determine which part of Medicare will cover that. The second thing would be a skilled nursing facility. This would be like a rehab center where you're staying overnight after a hospital stay. So imagine that somebody has a heart attack, maybe they have open heart surgery, and because of the fragile nature there of the chest, that they need to go to a facility to begin some therapy before they actually go home, so that they're a little bit more healed up and strengthened to do that. And that's what this will help to cover on that. Now, Medicare does not cover long-term care facilities like a nursing home. So if you get to a point where you are unable to take care of yourself, or the family's not able to take care of you, long-term care is not covered at all by Medicare, neither Parts A nor B. So Medicare will help you with a short-term recovery sort of situation, but not for long-term care. Just want you to understand that at the beginning. Third thing that it will cover, hope you never need it, but this would be hospice care. Hospice care is for those that are terminally ill, and this can be hospice care at home or in a facility, either one, but this would be covered under Part A. And then home health care would also be a Part A coverage. So let's talk about the costs that are associated when you're on Part A, or when you're having Part A services that are done. First, here's some good news. Usually, you don't pay a monthly premium to have Part A. Part B will generally have a monthly premium that they'll take out of your Social Security check if you're getting Social Security, or they'll send you the bill if you're not yet getting your Social Security. Part A, however, if you've worked or your spouse has worked a minimum of 10 years, then there's generally not a premium. Most of the people, and I mean the vast majority of people that we work with, do not pay a Part A premium. It is a very slim minority that do. But if you're in that situation where you or your spouse, neither one, worked those 10 years, you would pay a monthly premium of $278 a month or $505 per month, depending on how long you or your spouse worked. But again, for most of you watching this, you're probably not going to have that Part A monthly premium, but some of you may, and you just need to be aware of that. So two important things to know about original Medicare. This is very, very important. So I hope you'll lean in and listen. Number one, Medicare was never, ever designed to cover 100% of your medical costs. Since Medicare has been around in 1965, there has always been cost share. That means when you get medical help, medical care, you could very well have costs that you will have to pay. I'm still kind of shocked at how many people assume that Medicare covers 100% of everything, that if you're on Medicare, you don't have any cost share at all. And that's just simply not the case. So that's number one. Number two, and this is very, very important. Medicare does not have any limit on that cost sharing. There is not a magic number that if you have a really bad health year and say your share of the cost is 10,000 or 20,000 or something like that, there is not a magic cutoff. You could get billed for $100,000 or more when you're on original Medicare. There is no limit. It is unlimited in the amount of cost share. There is no financial safety net. Now, we'll talk more in another episode and a little bit here at the end of this one about what some of your options are to protect you from that. But just understand that if you only get original Medicare, you will have costs, and those costs are unlimited in what can come your way. Now, it's important to note here, when I use this word cover throughout the video, sometimes, and I'm guilty of this myself when I was younger and didn't fully understand insurance and got frustrated, I would hear this word cover, and I would kind of assume that cover meant that the insurance would pay 100%. That's not what cover means. Cover means that this is a service or a doctor or some kind of treatment that you will get that the insurance, and in this case, Medicare insurance, will help to pay. Now, sometimes that can be 100% coverage. Hospice care is one of those things that under Part A would be covered 100%. But as you'll see in just a moment, anything else will have some cost share that's associated with it. So when you hear the word cover, don't assume 100%, but understand that this is something that Medicare will help to pay for, and then you would be responsible possibly for a portion of that depending on your situation. So let's talk about the tiers of cost sharing for a hospital stay when you're on Part A. Now, this will be an all-inclusive kind of thing. So if you go into the hospital, you're having surgery, they take your heart out, they put a brand new heart in, something really crazy like that. These costs are all inclusive of that. So all the doctors, all the surgeries, all the bed, the food, all the medicine that you would get, except for some over-the-counter medicines. There's a few little things that are not covered, and you might get a small bill for those. But generally, all the prescribed kind of things, all the necessary kind of things would be help covered by Medicare. So the first part to understand that in 2024, you do have a deductible. Now, deductible is something, in fact, let's talk about that. The deductible is the amount that you pay first to the provider. So that would be to the hospital or wherever you're receiving the treatment before the insurance kicks in and does their part. So the deductible in 2024 is $1,632. This is a good news, bad news kind of thing. Good news is it will cover you in full up to 60 days. So once you pay your $1,632, Medicare pays 100% of everything above that. So that's an incredibly good news sort of thing. So if you're in there for 60 days, your bill, with minus any other, like little non-prescription drugs or something like that, would be at $1,632. Bad news is, if you're in there for only 1 day, it's still $1,632. So that's a flat amount for the entire stay up to 60 days. Now, here's an important thing to understand. The Part A deductible is not an annual deductible. It resets when you have not had a Part A event for 60 days. So this means that if you have multiple hospital stays in a calendar year, and if you timed your hospital stays just right, you had your events in just the right order, you could possibly pay that deductible 5 or 6 times in a calendar year if you had that many hospital stays. So understand that the deductible will reset after a 60-day benefit period has expired. And that means that you could pay multiple times in a year that $1,632. Now, again, these are the 2024 rates. If you're watching this in a year later, these could be a little bit higher. This tends to inch up a little bit every year, as do all the other Medicare costs. So once you have met the deductible, once you have been in there for a 60-day period, if you stay in there for 61 days up to 90 days, now on top of that deductible, you will also be billed by the hospital $408 per day. So that's an added thing. Now notice that third category over to the far right, that if you stay longer than 90 days, so 90 days through or 91 days through 150, that daily copay will jump up to $816 per day. So we'll talk more about how that'll look in real life examples in just a moment, but let me touch on this lifetime reserve days. So notice that third category over there. This is a special category of days that Medicare calls lifetime reserve days. That's that days 91 through 150. So if you can imagine, like a bucket of chicken, that's an easy thing for me to relate to. Medicare gives you a bucket of 60 hospital days to use over your lifetime for extended stays. Now, as extended stay is a single hospital stay of 91 days or more. So this is not adding up all your hospital days. This is like you've been in a bad situation and your single stay in that hospital without coming out is now ticking up to day 91, 92, and so forth. So when you get into those extended days, those lifetime reserve days, every day that you stay during that time takes one piece of chicken out of that bucket. It takes one day out of your bucket of lifetime reserve days. And these lifetime reserve days can be spent, so to speak, in a single stay or in multiple extended stays. So it doesn't matter how this gets used up. It will just get used up as you have any of those stays. So if you had a 91-day hospital stay and you got out by that 92nd day, you've only used up one of those days. But if you have a single hospital stay of 150 days, you have used up all of your lifetime reserve days in that single stay. And folks, they don't get replaced. They say this word lifetime because they mean it, that this is a limited amount of days that they will cover for stays of more than 90 days. Now, on the stays that are less than 90 days, there's no limit on those. So even if you have used up all of your lifetime reserve days and you have to go back another year to the hospital, and this time you stayed 89 days, well, all that original part of the cost sharing, the deductible and that $400 and change, $408 per day copay, that's still going to be okay. But notice that whenever you use up all of your lifetime reserve days, whenever you have a stay more than 90 days after that again, you will be responsible for all of your cost. And folks, if you're staying in the hospital for more than 150 days or more than 90 days even, you've got some big things going on and there's probably some expensive care, and you would be responsible for 100% of that. This is why Medicare gives you the opportunity to do some things to protect yourself, either through enrolling in a Medicare supplement or a Medicare Advantage plan. One of the scariest things for me to see is when someone has only original Medicare and no supplement or no Medicare Advantage plan. That's a dangerous position to be in. Both of those options, Medicare Supplement and Medicare Advantage, have safety nets that will help you tremendously. So we'll talk more about those options in another video, but just kind of park that right now. And maybe when you get through with this one, you'll want to jump ahead to that if that's an important consideration for you right away. The other thing that you're going to have cost share on is that skilled nursing facility. So if you have the rehab treatment, here's the great news. The first 20 days are 100% covered with Medicare Part A. So you have no copay, no deductible during that phase. However, once you hit day 21, it's $204 per day. So word to the wise is don't treat those first 20 days like a holiday. Yes, you might want to get away from family and enjoy the time hanging out in the rehab center. But man, if you can, turn on Eye of the Tiger, pretend like you're Rocky Balboa, work as hard as you can, and get out as quick as you can. You will do yourself a favor financially if you can really do your part in aiding your recovery and therapies while you're there, because that can start to add up if you stay longer than that. So just a little way to help save some money. So let me give you some real world examples because we've talked about all these numbers, but what does that really look like? Well, let's go with a kind of a short-term stay, medium-term stay, and that long-term stay where we're hitting in those lifetime reserves. So we'll have three different examples here just to kind of give you an idea. So the first one is the short-term stay, shorter, and that can be a stay of up to 60 days or any stay up to that. So a 1 day, 3 day, 5 day, 15-day stay, all of this will be exactly the same because the deductible is up to 60 days. So no matter how much it is between 1 and 60, it'll be the same. So again, you'll have your $1,632 deductible, and this is that all-inclusive rate that you have there while you're in the hospital, apart from like maybe some non-prescription medicines like aspirin or Tylenol that they might give you. So your total bill from the hospital, not from Medicare, it's going to be the hospital that sends you the bill. Medicare will send you what they call an explanation of benefits. And they will say on there, this is not a bill. They're just telling you that the hospital billed us this much. This is how much we allow. This is how much we paid. And you could get billed for that much. So you're not sending money to Medicare. You're sending it to the hospital. And so the hospital one is the bill that you need to pay attention to. And that's the one that you would need to pay. In the second example, let's say that we have a person that has a 75-day hospital stay. So they've had something a little bit more significant going on, and it took them into 75 days. So again, the first 60 days are fully covered by that $1,632. That's all the expenses that would be for those first 60. However, you now have 15 days. So 75 minus 60 gives us a remainder of 15 days that get that daily copay of $408. So 15 times 408, if my calculator is right, is $6,120. That's on top of that deductible. So the total of that 1,632 plus those 6,120 is $7,752. So that's what your bill would be. It's starting to get a little bit pricey. So again, a Medicare supplement or a Medicare Advantage plan could help lower those costs and maybe even significantly so. Third is we're going to be looking at one of those extended stays. We're using up 10 of those lifetime reserve days, and we now have a 100-day hospital stay. So it's been a pretty big deal that's been going on. And now we're getting out of the hospital after the 100 days, and this is the bill that you would get. So again, those first 60 days get billed $1,632. You've also got 30 days, that's days 60 through 90, that get billed for that $408 per day. So that's an additional $12,240. Plus now you're into 10 days of those lifetime reserve days. So it's double that daily copay. And so that's another $816 per day. So we've added on an additional $8,160. Total bill would be $22,032. Now, not horrible considering it's 100 days, but that's still a lot of money to consider, isn't it? And so this is why you do want to consider ways to help cover your cost share. So one of those would be a Medicare supplement. The other, and this would be very different, would be a Medicare Advantage plan. And the third would be maybe in a hospital indemnity plan. You can have that to go along with either one of those others. It works best with a Medicare Advantage plan. You really wouldn't need it with a Medicare supplement. But if you have a Medicare Advantage plan, this can help pay some of those daily copays that you have for the limited amount that you would have with a Medicare Advantage plan. But notice that for either one of those, a Medicare supplement or a Medicare Advantage plan, you would need both parts A and B in order to enroll in that. So you can't just have Part A and get a Medicare supplement or Medicare Advantage. You would need to have the Part B as well. Hey, if you've got questions, leave those in the comments about Part A. And if this has been helpful for you at all, hope that you'll like it, just to kind of let YouTube know that this is actually helpful information and other people might benefit from it as well. And that's just a great honor to us. We appreciate that. But if you would like individual help and you live in Arkansas, Louisiana, Mississippi, Oklahoma, or Texas, we'd be glad to help you out. Now, we don't work with every single insurance company, but we work with all the major carriers and some of the local carriers as well to be able to help you out with that. If you want to find all of those plans that are available in the area, you can always go to Medicare.gov. But if you'd like some individual free, there's never any cost for our services. We'd be glad to walk you through all of how Medicare works and just talk with you about how your situation might look with each of these different options. Again, there is zero pressure when you're working with us. We just want to help you sleep well at night because we sleep better at night when you're not calling us angry. But hey, if you want to reach out to us, there's my phone number, email address, and you can also go to our website and do a little more digging around and research there. And with that, there's a link on there where you can set up an appointment and we can do a one-on-one consultation with you. But in whatever way we can help, just let us know. If you're outside of that area and you have general questions about Medicare, you can leave that in the comments, and we'd be glad to help you if you do this within the next few days. Hey, thank you so much for watching. We'll look forward to seeing you next time when we talk about Medicare Part B, which is that outpatient coverage. Thanks a lot. God bless.